There we go. Hello, everybody. Hello, everybody. Welcome, welcome, welcome once again. Good evening, good morning, whatever part of the world you're watching us from. We're grateful that you joined us. This is a forum where we talk about all things relationship, and we have been running a series for the last couple of days on especially for us church girls or church folks, and we don't like to talk about matters that relate to sex. So we like to keep it on the down low, but they are quite important aspects of relationships. So here we try to dig in, dissect it, talk about it. We try not to use all of them or the foul and whatever language. We try to keep it clean and as professional as possible. So welcome to this blooming room. My name is Coach Chinyere, the facilitator and the owner of this page, and you are very welcome. For those of you who are just watching for the very first time, welcome. This is the third part of a series, Church and Sexuality, that we have been discussing. The first one was Ladies First. Of course, we had to tackle issues that relate to ladies and the issues they have in terms of the sexual relationships with their partners. And the second part of the series was brothers, you also have a role to play, and that one has been given quite a lot of views even on YouTube. I think at the moment is one of my best, in fact it is the best performing videos that I've done, and I hope that you take time to watch the first part and also the second part. And also today we're talking about when sex hurts, when it hurts. Now this one might relate more to the women, but I think that it is important for the men to have an understanding of why it's happening and what can be done about it. Yeah, because it's intercourse is about two people. So if one person is having issues that has to do with pain, and that is limiting the ability for that experience to be pleasurable or interesting or something that the person look forward to, then that could be problematic. So it's important that as a partner you also understand what could be resulting in this pain and how to deal with it. Now there are two main parts that pain is experienced during intercourse. Sorry, my voice sounds a little bit, I've been having flu, and so just forgive me, but I hope you can hear me. Okay, moving on. We want to tackle pain. Now, some of this pain is, this is the entrance. This is the entrance into the uterus. Yeah, this is the uterus. This is the entrance. This is the point. Probably here you have the clitoris, and then you have the walls of the vagina. So what is happening is oftentimes the pain is at the entrance or inside. Okay, so usually the pain is at the entrance or on the inside. Now, what could happen at the entrance? Perhaps things like a congenital deformity. The patterns, the flesh, the way it is structured around the entrance, something is amiss, and so the entrance is not clearly defined. That would have to be seen by ONG, or you see a reproductive health specialist. If that is where the issue is coming from, so they'll look into it and try to resolve that matter. Now, another thing that can happen is at the point of entry is also something called vaginismus. Now, vaginismus is muscle spasm, because this is the walls of the vagina, and so these are muscles. Okay, so when there's an entrance but there is spasm in the walls, so what happens when there's spasm? It constricts, so it limits the ability of the male member to pass through, and that can be very painful, because as a physical therapist, One of the things that we try to do when we work with patients that have injury and we're trying to improve their range of motion, we try to manage pain. We make sure that the patient has a pain regimen and the patient is following that pain regimen. Because one of the mechanisms with which the body protects itself from further pain and injury is by the muscles going into a spasm. So when a muscle goes into a spasm, it becomes tight. It is protective. So in the case of vaginismus, because the muscles are already tense, if you try to force a penetration, guess what happens to the muscles? They become what? They become tighter. Can it be treated? Can it be corrected? Absolutely. You just need to talk to a reproductive health specialist. You need to talk to your ONG, and they can look into it and help you to resolve the issues that is as the primary cause of this of the vaginismus. So it's just something that you need to have the back of your head, that sometimes it's something that is wrong that can be treated. Okay, so back again, what else can cause it? When you have eczema, or you have some sort of inflammation or skin disorder or infection, it can also cause pain. Why would it cause pain? Because if you have a disorder and the woman has a disorder or have an infection, it could affect the proper lining, because the muscles here, they're lined with epithelial cells that makes it easy for easy movement in, especially when you have a really good level of lubrication on the inside. It makes for easy passage. However, if you've ever had a sore palate, maybe you drank something that was too hot, or you have a sore throat, for instance, you know that when you swallow, it hurts. The movement of food from your mouth down to the throat, down to the abdomen, is not so smooth around this area. Is very uncomfortable. So if it's sore, if there's a bruise, it makes swallowing or chewing uncomfortable. So the same thing happens. So when you have an infection on the inside of the walls of the VJ, the normal lining that is on the inside is compromised, and so that the ability of the male member to pass through becomes compromised, and that can also result in pain. Okay, we've talked about congenital deformity, we've talked about vaginismus, which is a disorder that can be treated. We've talked about an infection or skin rash or eczema. People say eczema, yes, you could have eczema. Remember what eczema is, when it's an excessive drying. So you need to check what's going on there. Is it been attributed by maybe using perfumed toiletries, or you've been putting things in there that your body doesn't like in the walls of your, because the inside is almost similar to the outside. Yeah, you could have irritations and you have blisters and all of those things. So the same things can happen on the inside, just that the eyes are not seeing them, but it can happen. And so when that happens, that could also create issues with intercourse. So you need to see, again, you need to see your reproductive health specialist, you need to see your ONG, your gynecologist, and they can do exams to figure out where the issues are coming from and to prescribe the right treatment or the right medication. Okay, so now the fourth one that I would like to talk about, the fourth one, actually, when there's injury, when there's trauma, or when there's irritation. Injury, trauma, or irritation. Now, what can cause trauma? What can cause injury? What can cause irritation? Okay, it can be maybe an accident, or maybe you've had surgery at the pelvic area. Female circumcision can also cause it. Okay, so these are some of the things that it has been any kind of incision or cut around that area, it could cause an ongoing issue when there's intercourse. Now, this is another topic for another day. I've listed it out because this series is going to be about 7 or 8 episodes. And one of the issues I'm going to talk about is about, the session. Okay, so we're going to talk about that as well. So let us, at this time, however, look at the trauma or injury around that area. It can make the experience very painful. Now I know that you said, let me not go there, because I will leave that for when we talk about the circumcision, whether it's male or female, and we'll talk about the implications of both of them in terms of its impact in intimacy. Okay. Now the fifth one is insufficient lubrication. Insufficient lubrication. Okay. Insufficient lubrication can also cause pain during intercourse. Now, if your woman is not well lubricated, that can cause pain during intercourse. And there are a whole number of issues that can cause improper lubrication. There could be issues that have to do with there's no foreplay. If there's no foreplay in that relationship, if there's no foreplay, then you don't give her body time to become ready for the intercourse. So she'll be dry, and so you want to make sure that she's got enough. There's enough lubrication. It also could be something that has to do with menopause, because when women get to menopause, there's a compromise, a drop in certain hormones that are necessary to get the body ready. So that could also cause a drop in the amount of lubrication that happens when there was intercourse. And also drugs. Now, certain drugs are known to limit the ability of a woman to be fully lubricated naturally. When I'm talking lubrication, now I'm talking about natural, yeah? So it could be some drugs can cause, like high blood pressure drugs, things that have to do with antidepressants, sedatives, antihistamines. These have been known by reports to significantly impair or reduce the amount of lubrication that a woman can have during intercourse. So it's important that the individual not only make sure that there is sufficient foreplay. It's important. You can't just go boost, and you just no, you need to give the woman time to get ready, because her mind needs to be ready, her body needs to be ready, so foreplay gives enough time for all of her muscles to get the message that something is about to happen, and gives it time to secrete and moisturize the area to aid the process of penetration. So it's very, very important that foreplay happens. And also, if you're on certain medications, then you now need to look at what are the things that you could use to make it, because it's often advised actually that you do not use some other lubricants, to make that area, like instead of putting it on in the inside, perhaps you want to put it on the male member, so that as he is perhaps sliding in, he slides in with that lubrication, and it makes it for easy passage in. However, the kind of lubricant that is advised, you would need to talk to your gynecologist or your reproductive health specialist to talk you through, because there are all sorts of brands in the market. So it's better you talk to your ONG, your gynecologist, your gynecologist, and your reproductive health specialist, and they will talk you through that, because you want to make sure you're not using anything that has certain pH, especially if you're trying to have babies. Certain pH will throw off the men's sperm, and that could alter the ability of the egg to be fertilized. So you want to be careful about the kind of lubricant that you use to try to manage that situation. Now, we've been talking about pain at entry, but there is also pain on the inside. It's called deep pain. All of this time is pain when you're trying to get in. Now, pain on the inside. This could be caused by perhaps other kinds of medical issues, growth, whatever, around the walls of the cervix or the uterus itself. Things like, for instance, I know you know about fibroids. Those can cause pain because depending on because fibroids have the ability to grow outside, within the muscle itself, or outside. So depending on their size and the level of constriction on the vaginal wall, when you're trying to get in, you will feel pain. The lady will feel pain. So, and these are some of the issues that cause pain deep inside. It could also be any kind of inflammation or uterine prolapse, or when you have a retroverted uterus, a uterus that's not well positioned, is facing this way when it's probably should be facing this way, or is tilted to either to the right or to the left. Is the proper positioning of the uterus. So if it's tilted abnormally, it could cause pain. You know, that other kinds of things, the pelvic inflammations or pelvic diseases or all of that sorts of things can also, or cysts, ovarian cysts, can also cause pain deep inside. Then if there's ever been any surgery that has happened in the past and there's probably some scar, you see sometimes people have a cut and some scars are really clean and nice, but other ones are really like inflamed. So sometimes it can happen on the inside too. Excuse me. If a surgery has left a scar on the inside that has become inflamed, it could also cause pain. Okay, there could also be pain. So maybe treatments, maybe cancer that has been taken out and there's a big scar on the inside. So some of these things can cause pain, and sometimes some of these pains are also emotional. Yeah, they can also be emotional. If your spouse have had a problematic past, PE, or you know, when she was a child and all of that, it could also result in pain. Okay, it could also be thoughts of it alone, thoughts of someone touching your partner or anything of that sort. If you find that somebody has problems with intimacy, they're not comfortable being intimate, you know, they love you but they're not comfortable being with you, you need to find out what the source of that problem is, because oftentimes it could be that person was taken advantage of when they were much younger, and so you need to know what the problem is. You need to talk to a counselor, you need to talk to a therapist, you need to talk to your medical practitioner to talk you through what you can do to deal. Stress is also an issue. Now, you know, initially I talked about medication. Medication can also play a part, even for men, not necessarily causing pain for the men, but medications like high blood pressure have been known to decrease libido, the sexual drive in men. So you need to look at the side effects of that drug you're taking. Does it impact your performance? You used to talk to your gynecologist on the side effects. So sometimes it could be medication. Stress could also be an issue. It's one thing for the male member, for the massive muscle to stand. It's another thing for it to be able to withstand pressure. Sometimes they stand and then you a little weight on it and they collapse. So the strength also of standing upright could also be compromised when there's medication, and also when there's too much stress psychologically. Your body is doing it, your mind is somewhere else. There's a disconnect. So all of your muscles have not relaxed for a woman, and the man is there, he's probably rising and falling, but he rises to the occasion but cannot sustain the occasion. You understand what I mean? So that could also be what is playing out here. So it's pain is it's a complex thing to understand. You need to know your body, know your spouse, understand, seek proper help, and find ways to resolve this issue. But it's also it's very important that you have a trusted therapist, and you have a trusted gynecologist and reproductive health specialist that you talk to, that can talk you through this process. If you have further questions, please on Instagram, this blooming room 22. Also, this is my Facebook page, this blooming room. I'm also on YouTube, this blooming room, but with Coutinho, okay, with Coutinho. And visit our website www.thisbloomingroom.com, and we will see you again on the next episode of church and sexuality. Some of the things are not taught you in the church, but they're very important. It's important that as Christian couples or Christian couples, whether married or pre-married, that we have an understanding of these things, so that when we go into marriage or we go into long-term relationships, we have an understanding of what is waiting for us, and we can understand our bodies and bring our best selves into these relationships, and hopefully have a pretty good time with one another. So don't forget, I just recap what I just said before now. I said it could be vaginismus, a muscle contraction related issue. This could be scarring. It could be congenital deformity. It could be poor ability to lubricate properly. It could be related to medication and all whatnot. It could be emotional. It could be stress. It could be a whole host of things. But you need to understand what the problem is and how you can solve it. Okay, thank you very much. Coach Chinyere here. I'm bowing out. See you on the next episode of Church and Sexuality, where we help couples to have a good sexual relationship, even as they are having a good spiritual relationship. All right. Thank you. Good night.